Pakistan, and this is the webinar series which is done under the Association of Pakistani Physicians in North America, or APPNA subcommittee, which is MERIT subcommittee, which is Medical Education, Research, International Training, and Transfers of Technology. So MERIT subcommittee does these seven webinars every 2 weeks. So please stay tuned and join in. In addition, a plugin for our WhatsApp group is we have a digital library. We have a lot of resources in terms of clinical research on that WhatsApp group. And all of these webinars recording are available once the webinar are finished. If somebody would like to go back and listen to the webinar, or if you have missed a part of it, you can always go back. So with that being said, let me introduce our our presenter today. So our presenter today is Dr. BINAFSHA Manzoor Syed, who's the Professor of Multidisciplinary Research, Director of Medical Research Center, Office of Research Innovation and Commercialization, or ORIC, at the Liaquat University of Medical and Health Sciences in Jamshoro, Pakistan. She is a clinical research who is also editor-in-chief of the Liaquat Medical Research Journal. Her research interests primarily focus on cancer and aging, and she conducts regular workshops on research subjects and is a master trainer for PhD supervisor training. She's the principal investigator and lead in several clinical research projects. Her key research findings include the discovery of a novel molecular class of breast cancer, low ER luminal, and determining the cutoff point of telomere length for biological aging. Another project in the final stages of validation involves using saliva as a diagnostic tool for the early detection of oral cancer. She's leading a cancer database currently comprising 40,000 patients with a tumor archive in collaboration with the pathology department of Liaquat University of Medical and Health Sciences. So thank you so much, Dr. BINAFSHA Manzoor, and we apologize for some video issues, but please bear with us. And thank you for taking time. And I know you're very busy, but we appreciate it, and we're looking forward to hearing from you. So please take it away. Thank you so much.
Thank you so much, APPNA team, and especially this research team. Dr. Uzair, Dr. Wahid, they had been in touch with me, and I hope I'm visible. There is some issue with my video, but I hope this.
So we can see your PowerPoint.
Right. Yes.
We can see,
so
but it's in the
visible.
presenter view. It's visible, but it's in the presenter view. So you can go to presentation.
So yes.
Okay, perfect. It's working now. Okay, good.
Okay, so thank you so much for giving me this opportunity. I'll be talking about the work we are doing at Liaquat University of Medical Health Sciences. Before I start talking about research, I would like to give you some introduction of our university. So Liaquat University is one of the oldest medical schools started in Pakistan, and it was not Pakistan at that time. It was started in 1881 and then upgraded as a degree awarding college in 1942, and after a short period, it was shifted to Karachi and named as Dow Medical College. And after a short period of time, another college was started in Hyderabad, which was named after first Prime Minister of Pakistan, and it was Liaquat Medical College. It remained Liaquat Medical College until 2001, when it was upgraded as a medical university. And that was the first public sector medical university in Pakistan. In 2018, Blawal Medical College for Boys was established, and actually this college was established because there was shortage of male doctors in Sindh, especially because girls were not going to rural areas, so there were no male doctors in rural areas. That's why this college was established. And then College of Technology was added in 2019, and recently we have started a new campus in Thatta. And there's a short video about LUMHS.
Liaquat University of Medical and Health Sciences is the first seat of medical learning in Sindh. Starting as a medical school in 1881, this modest beginning was to become the harbinger of medical research and learning. Situated about 150 kilometers north to Karachi, and 15 kilometers from the city of Hyderabad on right bank of the river Indus. The campus spreads over 550 acres. This medical college, first established in the city of Hyderabad, was inaugurated by Sir Francis Modi, the first governor of Sindh. This school was upgraded to the status of medical college and named as the Sindh Medical College in 1945. By the end of the same year, it was renamed as Dow Medical College. The Sindh government subsequently started another college in the same premises of Civil Hospital at Hyderabad in 1951, which acquired its name Liaquat Medical College, after the name of the first Prime Minister of Pakistan. The college was later shifted to its new campus at Jamshoro in 1963. During its journey for more than 50 years, it made tremendous contributions in medical education, research, and healthcare. Initially, it ran MBBS courses only. The dental section was added in 1963. In the same year, the college also started postgraduate courses in various disciplines of medical sciences. It was upgraded as Postgraduate Institute in 1989. Besides, it became a recognized institution for the training for FCPS and MCPS, DCPS of CPSP in almost all disciplines of medicine, surgery, dentistry, and allied sciences. It is worth mentioning that General Medical Council of the UK granted recognition of its MBBS degree immediately after its first batch passed out in 1956. During the last 10 years, it has produced over 1,000 specialists in various disciplines of clinical and basic sciences, with postgraduate qualification of masters, MPhils, and diplomas. It attained the status of medical university in 2001 by an ordinance from Sindh Assembly. It offers postgraduate courses including PhD in more than 100 disciplines. The newly constructed facilities includes Professional Development Center, Diagnostic and Research Institute of Gastroenterology and Hepatology, Institute of Ophthalmology, Sindh Institute of Endocrinology and Diabetology, Institute of Dermatology and Venerology, Office of Research Innovation and Commercialization. Liaquat University of Medical and Health Sciences receives students from all over the country as well as foreign countries and has over 30 affiliated colleges. It provides boarding facilities to over 3,000 students, both male and female. At the campus, there are 6 hostels for boys, while there are also 6 hostels for the girl students and a working women hostel for postgraduate students. The journey to the present day's excellence wasn't that easy. With the help of Almighty Allah, LUMHS has acquired global standard within the short span by virtue of team efforts of the faculty members and administrative power. The vision and mission of LUMHS clearly outlines the roadmap that this university has set for itself. Bilawal Medical College is a constituent college of LUMHS established with an objective to overcome shortage of male doctors in the province. Bilawal Medical College is the only boys' medical college in Pakistan. The college has fully equipped lecture halls and laboratories with an unprecedented availability of Sectra 3D virtual dissection table in the anatomy department. Diagnostic and Research Laboratory was established in October 2002. This laboratory offers all laboratory investigations along with advanced diagnostic services to the public at highly subsidized rates. Liaquat University Medical College has a number of world-class laboratories that not only cater to the needs of its attached hospital, but also play a pivotal role in the ongoing research work by its research scholars. Institute of Dentistry. People's Nursing School. Institute of Physiotherapy. Institute of Biomedical Engineering and Technology. College of Pharmacy. Minimal Invasive Surgical Center. DNA Lab. DNA Lab was established in LUMHS in order to help the law enforcing agencies for furthering of justice and to train doctors in the best practices in forensic sciences. Water Testing and Surveillance Laboratory. Community Health FM Radio. No university can claim success in provision of modern education without a vibrant Department of Information Technology. There is an Arabic code that says, "He who has health has hope, and he who has hope has everything." LUMHS, in that sense, is cultivating and constantly nurturing hope in the region as well as the country. In the scientific world, the only thing that is permanent is change.
And for clinical research, the main foundation that provides us all the samples and patients, that is Diagnostic Research Laboratory. And currently we have more than 80 branches all over Sindh. So technically we collect all the data, including tissues and blood samples from almost entire Sindh. And we also have a recently established Cancer Research Laboratory at Medical Research Center. We have our DNA lab, which helped us in all genetic testing and biological analysis of materials. We also run 2 academic journals, and for that, I would like to invite APPNA members to contribute if they are interested to join as editorial members. I would welcome them. They can send me their CVs at my email given here, binafsha.syed@lumhs.edu.pk, or they want to publish their work, editorials, they are most welcome to send us. We also have LUMHS publishers, where we publish all medical related and allied health sciences related books free of cost. It's free for readers and free for authors, and nothing we charge even for any formatting or whatever the work required for designing and graphics added to the book. So it's completely free. If anyone is interested, you're most welcome to send us your draft. We'll go through it, and if possible, we'll publish it. Now, about research. So the Medical Research Center was established in 2004. Later, we divided it in 2 departments, basic research and a clinical research department, where we do all the basic work, proteomics, genomics, and we are working on different plants and herbs in order to have some new molecules. And we also work on animal models, cell culture, and basic research department for clinical research. Mainly, we are working at the moment on different biomolecular discovery so that we can have targeted therapy for cancer and other diseases. We are also working to establish clinical trial unit in our department. We have already started the process. So hopefully very soon it will be registered. These are our key thematic areas where we are working. That includes cancers, hematological disorders, genetic diseases, pulmonary diseases, metabolic syndrome, maternal child health, aging, skin disease, obesity, environmental health. We have many projects in all these different fields. But today I'll be talking about the innovative research which we are doing at LUMHS. And it was started back in 2011. When we started working on cancer, and we started with colorectal cancer and breast cancer when we want 2 grants from Higher Education Commission of Pakistan. So when we started working on those projects, we had to collect clinical data of patients, and we went to the store where these files were stored. And when we tried to retrieve breast cancer or colorectal cancer patients, we had to go through all these files. After 1 month of hard work, we could only retrieve 10 files. So then we decided that instead of going through each file and then select just breast cancer and colorectal patients, why not add all this data and establish a database so that we can have all cancers instead of just colorectal and breast cancer. It took us 3 years to establish that database, but we had then 22,000 patients data, including all cancers. And then when we had clinical data and their laboratory slips, so we tried to retrieve tumor blocks which were archived in our pathology department. So as I told you, there we have 80 different branches across the province. And so we retrieved all those tumor blocks, started with the colorectal cancer and breast cancer. And now we have completed almost all cancers. And then we established this archive, which is also now a member of WHO's Biobank project. And we have all the clinical data and most of the tumor blocks in good condition to study their biology. And when we looked at this data, we observed that the pattern of cancers in our region was different from rest of the world. As in our data, oral cancer was at the top, followed by breast cancer, larynx, lung, hematological cancers, liver and biliary tree, esophageal cancers, colorectal, urinary bladder, and ovary, which was different from the Globocon data presented in the global framework, global scape. And when even we looked at the data of Pakistan and Globocon, it was showing that oral cancer is at the top, which was in fraction if you look at the pattern of global cancers. So we thought to start working on colorectal cancer, breast cancer, and add oral cancer to start working on biology and also looking at the risk factors of these cancers. And then we expand our cancer research on other cancers as well. When we started working on that, we thought to have a dedicated laboratory to do this work. And for that, Higher Education Commission of Pakistan helped us and financially supported us to develop this laboratory. So now we have this cancer research laboratory where we do all the biological analysis of these tumors. So when we started working for just 2 cancers, and we had around 500 tumors, we spent around 7 million rupees to look at the biology of just around 500 tumors. So then we thought to have some alternate that we can do a good number of tumors in a economical way. So we brought this tissue microarray technique where we can stand instead of 1 tumor per slide, we can stand up to 300 tumors per slide. And in a way, we are saving up our cost up to 300 times. We have completed tissue microarray construction of colorectal, breast cancers, oral cancers, and we have started working on other cancers. So now we have around 40,000 patients because we keep updating this data, and we have tumor blocks of majority of these patients available with us. And because we had a large data set, then tumor blocks, and then we started working on risk factors. And then when we looked at the biology, we found different molecular patterns and their survival was not as good as reported in the world. So we thought to have a dedicated research institute. Again, Higher Education Commission of Pakistan supported us, and we are now almost ready to establish Institute of Cancer Research. This building is ready and will be handed over to us most likely next month. And then we are going to launch our Cancer Research Institute. There are many projects ongoing at LUMHS, but since this was about innovation, so particularly these few projects are very close to our hearts. So I wanted to share those projects here. One is the colorectal cancer project, which actually provided foundation of this breast cancer institute, then breast cancer, which was like sister project of colorectal cancer. We are now working on oral cancer, and there is one aging project. We are working on arsenic induced cancers because arsenic is one of the major problems in Sindh. We are also working on treatment of Parkinson's disease. So these projects are from our point of view, they provide us some like foundation, and some are really innovative. So that's why I wanted to present it here. Let's start with colorectal cancer. So when we submitted this project, it was biological characterization of colorectal cancers and correlation with the clinical outcome. We started with the data collection, and then we had a whole database of all cancers. And then we retrieved tumor blocks and studied biology, including a number of markers by using immunohistochemistry. And now we are working on P53KX67 and CDX genes, which came up as strong pillars of molecular classification of these colorectal cancers. When we did cluster analysis, we found 4 distinct molecular classes, and these were different on the basis of expression of Ki67, CDX2, and P53. So these 3 markers were actually indicating 3 different pathways. And when we looked at the clinical outcome, so the survival of these patients was extremely poor. Majority of patients died within like 26 months. When we looked at the factors, age was one of the major factors where younger patients were likely to die earlier as compared to elderly, where 50 years was the cutoff, and a good number of patients were younger patients coming with colorectal cancer. Then the breast cancer, when we started this project, it was really miserable conditions. Many women, more than 30%, were coming with the really advanced disease. They were reluctant to see doctors. So in addition to the research, we also started a mass campaign where we provided public education, public awareness. We went to universities where we tried to motivate and sensitize our youth, especially boys, so they can bring their females if they have any such problem. When we looked at the biology of breast cancer, so majority of cancers found in our patients were really aggressive. There is one type which showed hormonal expression. And these cancers are less aggressive. They respond well to hormonal therapy, and then patient experience very good survival. Unfortunately, in our population, it was found in only a small group of patients, where you can see there are 2 basal groups and 1 HER2 expressive. And for HER2 expressive, there is immunotherapy, which is a targeted therapy, and this is very expensive. A good number of our patients cannot afford this. And this was different from the biological pattern of breast cancers we have seen in the United Kingdom, because I did my PhD from Nottingham, and we did this analysis from those patients, British patients, where there were luminal A, luminal B, both groups were hormone sensitive. Then there was low ER luminal, which was exclusively found in elderly women. It was not present in younger patients. Probably that was the reason, because majority of our patients were very young. 50% of patients were under 45 years of age. And then there was only small proportion of basal-like, and then a smaller proportion of HER2 expressive, which was different from our population, where great majority were having aggressive cancers. And as it was portrayed in biology, their survival was also not very good and not comparable to British population. So that means we have to identify novel targets and novel therapies for our patients. Then the oral cancer, which was very common and top cancer in Pakistan, and many patients were coming, and they were young patients, and they were coming with the really advanced disease. And this is one of the patients who recently came to us. And the reason was because they develop a pre-malignant condition, oral submucous fibrosis, and they're unable to open their mouth. That's why they cannot show that they are developing a lump, or probably they do not feel it. And when they present, they already have this advanced disease. The major risk factor is this pan, supari, chalia. It's freely available in Pakistan. And this is the main cause. They develop oral submucous fibrosis like this, and they do not feel anything in their mouth, and eventually they develop those huge tumors. So we thought, because they cannot open their mouth, they are reluctant to see doctors, so we should have something like saliva kind of thing, and non-invasive. They just have to give their saliva, and then we wanted to make it as a diagnostic tool. So we mixed two methods. When body fluids such as ascites and urine pleural effusions are used for cytology, so we adopted that method, and for the method of pap smear was adopted to look at the cells. When we combined these two methods, initial results were not really successful, but now we have developed this system protocols where we can do cytology of saliva, and we can identify. Here you can see this is a saliva of a normal healthy person. This is saliva of oral cancer patient, where you can differentiate normal cells and cancer cells. They are actually visible. And in addition, obviously, because we will be using it as a screening tool. So just on cytology, which is very likely to miss a few cancer cells if they are there. So we had to add other things as well. So we try to look at the genetics, where we added, first thing is telomere length of the cells present in saliva, because normal cells have telomere length as normal. And oral submucous fibrosis, we suspected it must be lower because these cells are fibrosed. And then oral cancers, they must have a change in telomere length, which was actually proven. And there was significant difference in telomere length of cells present in healthy normal population and oral submucous fibrosis patients and oral cancer patients. Then we looked at different genes, and we found promising results of P53, where there was mutant P53. Now we are trying to add some more markers and make a system where we can accurately predict that this person has cancer, or they are developing cancer. So if we are successful and validate all these things in another cohort of patients, then hopefully we'll be able to make it a kind of early detection kit. Then another thing which we are doing is about aging, because there are patients, they look young, although they are elderly. And some patients, they look really older, but they are not that old chronologically. So in these patients, it's sometimes difficult to make a decision of treatment, and sometimes there is risk factor, but they do not develop disease. So there are so many things that we wanted to understand by looking at the biological age. So we tried to look at different markers, and then we finally chose telomere length, because telomere length is actually the knot at the end of chromosomes. So as with each cell division, chromosomes shorten, and eventually they reach to a certain level where they cannot be shortened anymore. And that is the process of senescence. So we tried to measure telomere length by a very simple economical method. And then we compared it correlated with chronological age. And here in this picture, one graph, you can see that there's as chronological age is increasing, telomere length was also shortening. And we then differentiated different age groups by measuring telomere length in this second graph, and it was significantly different. Then we looked at metabolic syndrome as one of the factors to expedite age, and it was actually causing expediting age, where you see this graph, healthy volunteers were having a longer length of telomere length as compared to metabolic syndrome patients, where those are controlled metabolic syndrome have slightly better telomere length as compared to those having uncontrolled metabolic syndrome. Now we are trying to correlate this telomere length with the disease outcome of acute MI patients, cardiac failure patients, and a patient with the chronic renal failure. And we are hoping to find this telomere length as one of the prognostic factors in these chronic diseases. Then we are working on different herbs and plants to discover different molecules which can be used in medicines. And the concept we got from Ayurvedic medicines. And this is one of the, these are seeds which are used for the treatment of Parkinson's disease, diabetes, and many other diseases. It was written that there was levodopa present, but it was not quantified and the quality of levodopa was not known. So we started looking at these seeds. Now we have identified levodopa, we have quantified it. This is good quality levodopa. And we are also looking at other molecules which are present in these seeds. So when the Hakims are giving these seeds to Parkinson's patients, they do not develop the number of complications they develop with the synthetic levodopa prescribed by doctors. So we think that there must be some antidote of those side effects in these seeds. So in addition to levodopa, we are also looking at other different markers. So we can have treatment of Parkinson's disease with less side effects and a natural levodopa. Then arsenic is one of the known carcinogen, and there is a belt from Sindh to Punjab where arsenic is at toxic level. And when we looked at the cancers coming from that region, the pattern was different, where hematological cancers were at the top. Urinary bladder cancer was higher as compared to rest of the population. So we started looking at other diseases, including cancers, and we are also looking at different biological methods to neutralize toxic effect of arsenic on human body. And this project is funded by Nanjing Medical University, China, and we are working in with the Chinese professors. Most of the work is done in China, and only a small proportion we are doing here. Now we have applied for another mega grant where we will be doing work on both sides, in China and in Pakistan as well. Then in addition to all these projects, we have this project where we are looking at different markers. This is just preliminary work we have done, but we are hoping to successfully produce cancer monoclonal antibody from human cells. This is just an idea, and the work is really at a seminal stage. But this is just a theoretical framework we have developed to have human monoclonal antibodies for cancer treatment. I don't know we'll be successful or not, because when we were establishing Cancer Research Laboratory, this project was one of the idea. And we also included flow cytometer and confocal microscope. But when we got the project and we received money, the cost of these things were too high because of inflation, and dollar rate went so high. So this was beyond our affordability, and that is of that project. Now we are trying to get more grants to get these two equipments, which are essential to work on this. And if not, then we'll be hunting for collaborations to do this work. This is my research team. My colleagues and my PhD student. I was trying to get their pictures, but I got the idea very late, so couldn't find their pictures. This is my email address and mobile number for communication and collaborations if anybody is interested. And thank you so much. I hope I was within time.
Yes, absolutely. So thank you so much for a very enlightening lecture, and of course very commendable the tumor registry and the efforts that you and your team has done. Very excellent. So we have two commentators, Dr. Jabin Fayyaz and Dr. Umar Hayat. So I will request them to provide their comments, and then we'll go to the questions. Thank you.
Thank you very much, Sarfraz, and thanks, Dr. BINAFSHA. That has been great. I will let Jabin probably to go first, and then I will come back to you with a few comments and a few questions. Dr. Jabin, please.
Thank you so much, Sarfraz, Dr. Omar, and Dr. Banafsha. It is very, very enlightening talk, actually, to see such amazing work and how, with limited resources, still this has been made possible by everybody's effort there. I'm really struck, like when you are presenting, that we always think that, okay, research is being done, but what is next? So you have really truly shown or enlightened all of us that how research can tie into clinical improvement, and it is directly linked, and how can we improve the quality of life and patient safety and quality of care. So thank you so much to you, to your team, and to your leadership.
Thank you.
I'm just wondering, I know it is not easy task which you have taken upon and accomplished. If you can just tell us a little bit about what are the challenges you found during all this, and then I really feel like there's a huge opportunity there for collaboration, not only international, but also national collaboration. So some of your thoughts about, because I know there's some work happening on cancer research in, especially in breast cancer in other parts of the Pakistan as well. So I just want your views about it, that what are some of your challenges and views and opportunities about collaboration nationally and internationally.
Yeah. When we started, then it was really difficult to even make other people understand that how we are collecting this data, because there was no trust, and people wanted, even our colleagues, they wanted to have this small piece of data with them. They were not sharing it. But when Professor Ikram took over and he was administrator of pathology laboratory, he gave me free hand, and then we started collaborating with each other, and he's main partner from pathology department. He provided all the tumors. So this teamwork, development of this teamwork and this trust was the first challenge. And then of course money. And when we submitted a project in 2014, it was approved in 16, and we got money in 2018. And unfortunately in 19, when we started procurement, the dollar immediately went up and rupee was down. So like confocal microscope was at that time in 2014, we got quotation. It was 15 million, then it went to 25 million. And now they are saying it is 120 million and even more than that. So this is the major challenge. But fortunately, Higher Education Commission of Pakistan, they remain big support for us. And they have developed their trust. And so most of the things are now getting better. And then sometimes procurement and delivery of some reagents is very difficult, especially when this was COVID. I think it was everywhere, but we had a little harder to get reagents and then LCs and then transfer of money. So this is the major challenge.
Thank you, Banafsha. It's very, very. I will pass it on to Dr. Omar.
Thank you very much, Dr. BINAFSHA. I will say I was impressed on so many fronts. Normally, whenever you realize the importance of something, normally people implement from current to going forward. So I was really impressed, like how you went back and through the paperwork and still was able to find the patients, and now you have a library of like a 40,000 patient cancer patients. That's really amazing. The second part, which really also touched me, the pictures you put, like for the patients, because very often we hear these names, but it doesn't tell us the level of the disease. So that was very much like a eye-opening to me because not always I see the oral patients. The other thing, I think there was a will, so which was really interest to notice. I mean, not always you need the sophisticated technology to diagnose the patients. With the limited resources you have, you guys came up with this like the cytology and taking the saliva and assessing or screening the the cancer patients. That's what really touching. And not only that, I saw also, even though it's a little effort, like measuring the length of the cells, I mean, you try to quantify as far you can do with your limited resource. So that was really amazing. I will say hat to you guys and to your team. For the research, it's something with a continuous improvement. I know as a country, as institutions, we don't have that big donors or like even the university collaborations and so forth. I will strongly recommend, probably we need to develop and I also heard that you're working on the animal models. I'm a CEO of a Trials 360, and we are currently negotiating few projects on the cancer. So I think I will ask my team to approach you, and probably we can collaborate on the animal models, like how we can induce the disease, and then we will also screen the compounds to see like how to pick the signal of the compounds. But I really will say amazing job, and thank you very much for sharing with us. Thanks. Back to you, Sirfaz.
Okay, thank you for your comments. And Dr. Javeen, if there are any questions, if you want to pick some questions and pose it to Dr. BINAFSHA, please.
Yeah, sure. There is a few hands up. I'm not sure whether they will be asked their questions, Sarfraz, by themselves, or should we ask them to write it down in Q&A?
So I think let's do the. Sorry,
go ahead.
Sarfraz, can I propose? I'm saying that given we have a bit of time, so we can respond to the questions which are already listed. One is basically they're asking for the WhatsApp group number. I mean, WhatsApp group link. So probably, Sarfraz, if you have, you can share it. I know Dr. Uzair would have.
I can share it. Okay. Yeah, but if Waleed is in there, he can maybe put it in. I will also put it also. So that's not an issue. But let's ask questions, Dr. BINAFSHA.
That was one of the questions, and the next question is, you mentioned a journal you guys published. So the question was whether this is international or national.
It's a DOAJ indexed, and at the moment it's national, recognized by HEC and Y category. But our another journal, LUMHS, I showed two journals. One, there's a Liaquat Medical Research Journal. I'm looking after that journal. It is relatively new, and LUMHS, which is a Scopus indexed.
So we have
international.
I see. Thank you.
Yeah.
Thank you very much. So we have anonymous attendee. I mean, he is a first-year student, and he wants to know what is the best stage to join a research program. I mean, of course, he's a first-year student, must be asking like, at what year he will qualify to join your research programs.
I'm sure, like everywhere, we involve our first-year students in research, and they have proper structured program. They have to attend classes and then have to write a project and work on that and write a manuscript. Then in addition to that, I have started Cancer Research Fellowship, where our undergraduate student can register themselves. We have proper, again, structured program. They have to attend sessions and do a research project under supervision, and they have to publish it in international index journal. So there is no bar. They can join anytime in research.
Thank you very much, Dr. BINAFSHA. So I think even your what the paper exercise and you need to dig through the files, this kind of projects can be given to the early internees as well.
Yes, they are working on the patients who are not responding. Like we have their data from papers, we have their tumors, but we don't know their current status. So this is the task for undergraduate student. They call them and ask about if they passed away, then what was the cause of death, how they died. So this is the task for undergraduate student. And currently we have 300 undergraduate students working on this cancer research database. And they regularly update them as well.
Thank you. Thank you very much. So I think that we have addressed the questions which were listed in the QA box. So Jabin, I will get back to you and then you can take over and then
So
see who is raising the
I
hands if
think
you guys want.
I think
Sorry, go ahead,
yeah.
sir.
So I was suggesting that if people who have raised hand, if Walid, if you can unmute them and they can ask the questions, I think probably that would be good. So Shabia Khatri, can you speak up, please? I don't think we can hear you.
Yeah, Shabia has written her question in the chat. She said, I want to ask Dr. Binafsha that how can a medical student collaborate with you and what way? And in the comments, Binafsha, people have asked if you can share your email, if they are okay connecting with you through email.
Yes, I shared it in last slide. I'm sharing that slide again.
So a lot of question how to connect with Dr. Binafsha. She's sharing her email. You can
Yeah,
have.
or they can simply go to LUMHS website and my email address is there. Or even they can simply Google it.
Thank you so much for being so generous with your time and sharing this. Rafiq Kanani, if you want to unmute yourself and ask the question.
Ji, Assalamu alaikum.
Wa alaikum assalam.
I'm Professor Dr. Rafiq Khanani, Bakai Medical University.
Right.
I've got, since I'm PhD supervisor, I'm supervising two candidates and both of them are working on early diagnosis of oropharyngeal cancers through saliva.
Oh, wow.
And I'm really impressed by the presentation of Banafsha, and Liaquat University is doing a lot of work on it. So I would just like to find out the contact person there so that my students can work with them and learn from them, as well as share their own samples and data, whatever it is required.
Yep. My postdoc, Dr. Sikandar Memon, is working on this, and one of my PhD student, Dr. Azim, is working on this project. And a couple of undergraduate students, they bring all these patients and healthy volunteers. So this is team of 4 people, and you can just text me on this number, and I'll share contact number of my students so you can connect with them, or you can write it to me and send your students to us.
Thank you very much. And you are really
Thank
doing a
you.
great job, and I hope that we will come up with certain new technologies and
Inshallah.
diagnostic tools.
Yes,
Thank you.
inshallah.
So we have 2 more hands up. So in that order, for whoever is Y01, Y66, and then NBUT. So we'll go to first Y01, Y66, and then NBUT. You can unmute yourself. I don't know whoever is Y660, you have raised your hand. So if you want to ask a question, please. Otherwise, we'll go to, yeah.
Hello?
Yes, we can hear you. Please go ahead and ask your question.
It's very interesting talk we have listened to. I'm not a biologist, but as a researcher, I would like to say there are so many projects nicely started, but mostly I heard that the initial successful results were not enough. So I would suggest as a researcher to pick up one or two, say, on breast cancer and go deep into it and get it quality. Because the funding is always scarce. So my suggestion would be here, instead of taking too many projects and spreading the energy, it's a very good team I looked at, and take one or two projects and go deep into it and get the quality as good as anywhere in the international world. Thank you very much. It was a nice, I'll probably taken down the email and maybe I correspond. Thanks very much.
Yeah, sure. Thank you.
Thank you. And then I think Dr. Ajay Kumar has his hands up. Please ask your question.
Hi everyone. Can you listen me?
Yes, we can hear you.
Hi. So first of all, I want to appreciate the work Dr. BINAFSHA is doing, and I'm a fresh graduate of Ghulam Muhammad Mar Medical College, Sakhar, and currently I am actually on the path of USMLE, and I am doing some observerships in US. So I was looking for some research opportunities, and I have to ask Dr. BINAFSHA that is there any remote research opportunity that I can avail and work with you and your team?
We are working on a couple of systematic reviews and meta-analysis. Remotely, you can join them, but if you want to work on tissues or patients, then unfortunately, you cannot do it remotely. Or if you are working under supervision, so we can collaborate, then you can replicate that work in your institution.
Yeah, actually, my student currently is doing nothing at all about the research, so I don't have any opportunity from there. So I'm currently in US, and I can work remotely with you and learn more about the research and things like that, because I have keen interest in research.
Yeah, you can drop me an email or just drop me a text. Then we can discuss how can we work. But remotely, you can work on systematic reviews and meta-analysis easily to start with.
Yeah, that's perfect. That's perfect. Thank you so much. I will drop a text message or email to you. Thank you so much.
Yep, sure.
Okay, thank you. I don't see any more questions unless I'm overlooking something else. Dr. Jabin or Dr. Omar, do you see any questions in the Q&A chat?
There's some logistic questions that we are getting. Can we get the recording link through email? And also people are requesting for more sessions regarding undergraduate research, how they can start. There's one question, BINAFSHA, which you probably can tell us, that when does the next round for the Cancer Research Fellowship registration will open?
We were planning to start in August, but some of our student groups' work is still pending. So hopefully by September or October, we'll make an announcement.
Okay, perfect. So stay tuned, keep your, keep looking at it, and then it will be announced. Yes, that's
And then
what.
the recording, yeah. So, and the recording is available on the YouTube channel of APPNA MERIT. So you can just go there. And also the digital library link is shared in the chat by Waleed. So you can always log on, you can subscribe to the WhatsApp group. So recording is available there too. So as soon as the session is done, the technical team led by Waleed and his colleagues will post the video both at the WhatsApp group as well as the YouTube channel. So everything is available. Okay, so if there is nothing more, again, would like to extend our sincere thanks to Dr. BINAFSHA for sharing the wonderful work that she and her team are doing. And this is very excellent and eye-opening that with limited resources, how things can be achieved. So thank you so much for enlightening us, and thank you for the remarkable work that you're doing. And thank you to our moderators, both Dr. Javeen, Fayaz, and Dr. Umar Hayat, for their comments, and for all the participants for attending. Please stay tuned for our next announcement for webinar, which will be in another 2 weeks at the same place, same time. And lastly, but not least, I would like to thank Waleed and his team for always working behind the scenes to make sure that these webinars go smoothly. There's a lot of technical effort that goes behind these, so we truly appreciate their hard work. And have a good rest of the day, everyone. And inshallah, see you all in about 2 weeks. Thank you.
Thank
Thank you
you.
so much. Bye bye. Jazakallah. Thank you.
Thank you so much.
Thanks.
Allah Hafiz.
Thank
Allah
Thanks,
Hafiz.
Jazakallah.